Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. Wow, what an important topic we're going to talk about today. This topic probably is affecting you, and you may not even realize it. Most of us, if we were interviewed and we were honest, and somebody asked you the question, in regard to energy, with 100% being where you as a healthy person, a really healthy person would be, where are you at? And I think most of us, man, we would say like 70%. You know, isn't it true? Whether you're a mom, you're a doctor, you work in an office, like most of us, there just is a fatigue, and it's like, what's causing this? What's causing this? I'll give you an example. Yesterday, I used to be an endurance swimmer. Like Nicole's here, there was a time period where I raced her in a pool at 5:30 in the morning in Cape Girardeau, Missouri, and it was who could do 5,000 yards or meters first, and she beat me by only probably 4 minutes or something. So I mean, that's the kind of endurance shape I was in with swimming. And then yesterday I'm swimming just like one lap of the pool, and something's not right. So many of us have things that are happening to our body that we just don't know. And by this YouTube station, I say it over and over again, it's normally jugular vein compression. So jugular vein compression, because of a breakdown of the neck curve, the brain can't drain, so there you have brain fog. The brain can't drain, get rid of toxins, waste products, so it's like your brain is sitting in toilet water. So that's not going to be good. So that might be happening. Then 2 is, because I've been writing, a lot of stuff's going on in the last year. I'm not working on my neck curve. I'm bent down all the time. So let's just say my curve, instead of being this way, now it's a little bit this way. Well, that little bit of this way is going to crowd things in the front of the neck. So what's in the front of the neck? The most compressible thing is the jugular vein, but the vagus nerve can also be stretched and compressed. So then people get vagus nerve dysfunction, which relates to tachycardia, poor digestion, problems breathing. But the other thing we don't think about, what gets compressed in the front of the neck, is the airway. Is just simply the airway. Just because the neck curve isn't going this way and now it's going this way, the airway gets compressed. And this is actually from a person's CT scan. So the CT scan, you see the airway here, right? You see the airway there, and look at right there in the larynx. Look at how it's getting compressed. So do you think that this might give you shortness of breath, give you asthma symptoms, make you fatigued? They might not even know that they're short of breath, but they do know that they can't exercise like they used to, or you're like Dr. Hauser, you're swimming in a pool and you're like, something's not right. They just know that something's not right. Well, I'm just telling you, one of the things that's not right is upper airway resistance syndrome. Severe upper airway constriction as shown on the cone beam CT scan. People who have this upper airway resistance syndrome, they're not seeing me just for shortness of breath, or just for air hunger, or just for fatigue. So because when the neck curve breaks down, it screws up the airway, it screws up the vagus nerve, it screws up the jugular vein. So if you've watched other videos and you know that this stuff's happening to you, like you have brain fog, you have migraine headaches, your vision is going, you have blurry vision, it's probable this is happening too. And then you always hear me say, you've got to have a look-up lifestyle, look-up lifestyle. Look-down lifestyle is going to lead to this. Like you're going to end up where people feel like they're choking, they have a lot of secretions, they have air starvation, and basically all the cells of your body need D-glucose dextrose. That's like the substrate from the food we get, and that's the main ingredient, dextrose, that we use in prolotherapy. Every cell needs that for nutrition, and the other thing that it needs is oxygen. upper airway resistance syndrome. So there's lots of different symptoms that are associated with it. When they've diagnosed somebody with upper airway resistance syndrome, what are some other symptoms they probably have or they're more likely to have? And you see all these: chronic insomnia, bruxism, hyperactivity, irritable bowel. And basically, upper airway resistance syndrome is resistance of airflow in the upper airway, which leads to symptoms including shortness of breath, which is dyspnea. Then, of course, the oxygen isn't so good at night, so they have daytime sleepiness, fatigue, and poor sleep. So there's decreased oxygen saturation during sleeping. With upper airway resistance syndrome, there's an increased effort needed to overcome the resistance to breathing, leading to multiple arousals from sleep and associated daytime symptoms. So how does modern medicine treat this? Well, modern medicine treats this by CPAP, continuous positive airway pressure. So there's a narrowing, right? Sleep apnea, obstructive sleep apnea. So they're going to have you wear a mask and they're going to push. They're going to push the oxygen into your system. So if I have a narrowed airway here, you could say that's going to help me, and I'm not negating that sometimes you need to do that, but wouldn't it be easier and better if I just worked on my neck curve better and gave my airway more room in the front here? Wouldn't that make a lot more sense? So that's how we treat it. And look at this. There's approximately 1 billion people worldwide that have this, or 24% of men and 9% of women. One thing that I've often thought about is bruxism. Like, why is the person's like, like they're just biting, they're chomping down on their teeth all night. And one of the other things that narrows the airway is what? Is your jaw, right? So again, multiple arousals during the night, sleeplessness, bruxism. It could just be your body's many cries for oxygen. Your body during the night is trying to get oxygen, trying to get oxygen. So it's trying to get you to move in a position because it's dangerous because you don't have enough oxygen. So obviously if Dr. Hauser during the night isn't getting enough oxygen, that's serious to me, right? Because that puts my health at risk. So that's why I just want to research a little bit more about what device that I should get to monitor my oxygen. But I think that's kind of one of the reasons why I'm doing this video is that, I need this. So there's lots of different causes of upper airway resistance. So when I do a physical exam on a new patient, if I see humongous tonsils, and I have recommended that sometimes people get their tonsils out because, again, if you have humongous tonsils, that can narrow the airway. So anything that's narrowing your airway, right? So if we think about air going in, air goes in through the nose. It's supposed to go in through the nose. It can go in through the mouth. So the mouth is blocked by your tongue not being in the right position, your enlarged tonsils. The nose can be narrowed. Why? Because of allergies or a deviated septum, which we'll talk about. Then here in the oral pharynx and the larynx, it can be narrowed because of cervical dysstructure. That's the cause that we most commonly find. It can be caused by vocal cord dysfunction. So I'd really recommend you guys see my video on vocal cord dysfunction because in the larynx, you produce voice because air flows across your vocal folds, and that's what gives you the different pitch. You can sing la 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 la, like different things you can sing. So that's from your vocal folds changing, but if you have vagus nerve degeneration and those vocal folds can't function properly, that airway can get narrowed. And of course in your lungs, you can have airway resistance because of allergies or asthma. And even that, I think, is from the vagus nerve. So cervical dysstructure causes upper airway resistance syndrome from multiple mechanisms, including narrowing the airway to 2, vagus nerve degeneration, not allowing the vocal folds to open, or what I call leaky lung or leaky larynx, where the vagus nerve doesn't innervate the mucosal surfaces, so the mucosal surfaces are spread apart, and then irritants like allergens can get into the body more, so the body gets hypersensitive to them, which we call asthma or allergies. But a better treatment than medications would be, why don't we correct the neck structure to correct the physiology that led to the asthma or cause the allergies. You know, we all have been kids or have kids, crowded mouth with different bad structures of the mandible or the teeth, deviated septum. But a breakdown of the cervical curve, in my opinion, is the #1 cause. And this is what you see. You know, the airways narrowed here, and I'll show later on even some more. And then this was even a patient where the whole thing was closed. Man, did they have a lot of shortness of breath. And then the normal cause of it is just poor posture. Poor posture, poor posture. We got to get to good posture. Oh, I'm sorry. Okay. Yeah, I'm doing better. And this is basically what it looks like, right? And in this patient, they had some things going on with they had a calcified thyroid cartilage. There's lots of different things. This person also had cervical dysstructure. And then the spectrum of sleep-related breathing disorders, right? Upper airway resistance syndrome, you have primarily seen it as obstructive sleep apnea. We hear that a lot, sleep apnea. Sleep apnea is basically something's closing off your airway, so your oxygen saturation, meaning the amount of oxygen carried by your red blood cells, is going down. So if your oxygen in your red blood cells is going down, and normal is like 99%. You know, so 99% of the maximum amount of oxygen on your red blood cells, that gives you an oxygen saturation of 99%. So if I monitored myself and I had episodes where I'm going down to 82% or 83%, it would probably be the times where there's a loud snoring. Like my body's trying to get oxygen into my body. So that means that during the night, my cells, my tissues, my brain wouldn't be getting the normal amount of oxygen. So am I going to wake up refreshed or am I going to wake up tired, right? So just being honest, real with you guys, that sleep-related breathing disorders, I have that. I need help with it, so pray for me. And I hope that this video is going to help you guys. But basically it starts with, we have to take responsibility with our neck curve. And if we have instability, like I don't have, you know, neck pain now, so I don't think it's related to instability for me. It's just going to be that I've just been really heavily writing. I've been writing a lot. And, you know, even just putting this stuff together, it's a lot of research and a lot of writing. I love these, you know, I'm a big fan of these because I like to put on paper all the different mechanisms by which cervical dysstructure and ligamentous cervical instability causes sleep-related disorders. So one of the things that I've started for me is taking melatonin. So I take 10 milligrams of melatonin. Well, it turns out that when your brain pressure is high, one of the glands that's affected is the pineal gland. Well, the pineal gland makes melatonin. So it could be, one of the things is I'm just missing melatonin. That's one way. Now, cervical dysstructure, breakdown of the neck curve, causes mechanical obstruction. That's the cone beam CT scans that I showed you. That increases airway resistance. It gives you snoring, obstructive sleep apnea, and upper airway resistance syndrome. And that, of course, can give you interrupted sleep and result in chronic fatigue. Obviously, internal jugular vein compression causes increased brain pressure, and that could cause central sleep apnea. But either way, the treatment of this is if you have ligamentous cervical instability, upper cervical instability. How would I know if I have that? Well, if you have clicking, popping, grinding in your neck, or sleep problems started after a trauma, car accident, football game, after, like me, it was hours and hours and weeks and 6 months of like bending over and writing and this and that. Like, you know, it's probably related to something in your neck. If you got a chiropractic adjustment or you did some kind of exercise, like I'll have people, they'll be weightlifting or something and they'll jerk their head, or they'll be in some exercise class and they notice that something popped and then all of a sudden they got symptoms of head pressure, fatigue, migraine headaches. Then they got a new clicking, popping, grinding in the neck. Well, you know, like your neck's not supposed to click, pop, or grind. Mine does, and that's why I don't think right now I have ligamentous cervical instability. I think it's just, you know, when I write, I don't worry about my posture. I just can't. I just write. You know, I get in the zone, and I might write for 10 hours, so it's 10 hours of bad posture. So in other words, unless I do something to counteract the 10 hours of bad posture, I'm going to end up where my atlas is forward. And I'm going to illustrate something that I show patients in the room, because I've done this recently. So what I do is, I'm just going to stand up for a second. So I have a wall, and this is the test that I share with them, and I'm going to explain how it relates to me. So what's supposed to happen is, imagine your back of your feet are against the wall, your hands are faced forward, your hands are against the wall, and then your head's touching the wall. And then I asked you for 30 minutes, imagine this, for 30 minutes, I want you in the posture where you could watch a TV show or watch a YouTube video or something. Like, it's across the wall, like let's just say 15 feet across the wall. So in other words, let's just say for me, it was like this. This is where everything's touching the wall. That wouldn't be comfortable for me, and I don't think I could do it for 30 minutes. But what I could do is I could go like this. See, now I just went like this. So I could do this posture for 30 minutes. Well, basically, the difference between this and this, for me, is a little over an inch. Like, let's just say 1.2 inches. So I'm telling you, when I scan myself, it's going to show that Dr. Hauser's atlas right now is 1.2 inches too far forward. So obviously, that's going to do what? It's going to probably constrict my upper airway. It's probably going to constrict my jugular veins a little bit. So that's something you guys can use at home, where I'm just telling you, if you can't hold that position for 30 minutes, your atlas is forward, and you know all the different problems that an atlas forward causes. Vagus nerve degeneration, jugular vein, affects your brain and your body. So that's what this is. Upper airway resistance treatment. So basically, ENT doctors, allergists, neurologists, you know, different people, they do lots of different things. Like, obviously, if somebody has a deviated septum, the ear, nose, and throat doctor will, you know, get that open, and we'll talk about that. Obviously, they can take out the tonsils. Somebody could get allergy elimination. When I was a kid, I had probably 10 years of allergy shots, me and my sister. If somebody's overweight, right, sleep apnea, they've definitely associated with being overweight, so weight loss. In our office, what we find is the problems are related to cervical instability, breakdown of the cervical curve, and vagus nerve dysfunction. So we work on cervical curve correction exercises, ergonomics, look up, sleep in a position that your jugular veins are open, that are promoting a neck curve, prolotherapy, and lifestyle modification. What led me to do this isn't just what's going on with me, but I had a patient. It's just really interesting to me. What interests me is, like, people will get surgeries, right? They'll get a surgery for something, then after the surgery, they pretty much have the same symptoms. Like, that always fascinated me. Like, somebody has low back pain, and they would do all these operations on the lower back. Then I'd say, how was the operation? And they're like, doc, it didn't do nothing. You know, so there's only a couple of reasons for that, but the main reason has to be the surgery didn't address what's causing the problem. So imagine somebody says, I can't breathe, but they can't breathe because their neck structure is all screwed up and it's obstructing the airway, but the doctor finds they have a deviated septum. So this patient came in, they had the deviated septum surgery, and it didn't do nothing. If anything, they said, I'm worse than ever. So that's called empty nose syndrome. So basically, I started this doing something on empty nose, but basically the cause of empty nose syndrome in a lot of people is upper airway resistance syndrome. So empty nose syndrome is where you have a deviated septum, the doctor does surgery, then they're like, nope, I can't breathe through my nose. So you get shortness of breath, nasal dryness, nasal burning, nasal obstruction, feeling of suffocation, malaise, depression. And then if you look here, see how on the left side of this person's nose, this is a cone beam CT scan. We do these kind of scans in our office. See how this is all open? That's how it's supposed to be. But see on the right side, see how it goes this way? You see that? See the difference? So a doctor would just open up this side and then both sides would be open. So they would get a surgery for a deviated septum. Then this is empty nose syndrome, causes, symptoms, diagnostic and current treatment strategy. So you could see where they, there's surgical things that you would do, there's humidification, do allergy elimination, do corticosteroids, but really the underlying cause likely is going to be because the upper airway, there's resistance to airflow this way. I just put this on here because if somebody has a symptom that seems to be mucosal, like for instance, if somebody said to me, Doc, it feels like sandpaper in my nose, it feels like sandpaper in the back of my throat, or there's like an irritation, there's such a deep, irritating, scratchy kind of feeling, I'm thinking, again, Hauser's law. Hauser's law is if you have a symptom that's elusive or a condition or disease where the cause is elusive, follow the neurology. So if we follow the neurology of the nose or neurology of the upper airway, the neurology is going to lead to you what is the cause of the condition, which is some kind of ligamentous joint instability, where all of this stuff, like if you just looked at this levator palatini muscle, that's the vagus nerve, and the nerve supply here, sphenopalatine, it's all going to relate somehow to ligamentous joint instability in the neck, or what we call ligamentous cervical instability. So basically, this is what is supposed to look like. See how open the airway is? Look at that. And then this is what we see. This is normal. So I just have a feeling that's probably where my airway is right now. And that's why I'm snoring so much, or you're snoring so much. Because imagine, especially if you lay back, the tongue's just going to go there, right? The tongue's just going to go back there. And then you're going to cut off your airway. So again, the treatment is going to be at what is causing the sleep-related disorder, what's causing the snoring, what's causing the obstruction, what's causing the upper airway resistance, which almost always relates to the neck. So doing cervical curve correction, and if instability is present, then do prolotherapy. I'm here with just a great lady, Lisa. Lisa, now you're here for basically your 9th prolotherapy visit, right?
Right.
And then why did you decide to come here? And part of why I wanted to do this video was that you had some shortness of breath or trouble catching breath, and then you're a singer, so you basically the condition that you have, it was affecting your singing voice. But what originally led you to come here?
Originally it was the vagus nerve, so I had a spinning session that was really bad, and my heart rate dropped to 40, and the next day I was in my doctor's office and my heart rate was still at 40.
When you say spinning, what do you mean?
Vertigo.
Oh, you had vertigo, okay.
Yeah.
I was thinking like spin class or something.
No, severe vertigo.
Severe vertigo, okay, gotcha.
Ended up in my doctor's office the next day with a heart rate of 40, and I said, I'm having some acid reflux as well. Should I be worried about that? Because I know that deals with the heart. And he said, no, that's just your vagus nerve. I'd never even heard of my vagus nerve before. So I started doing some research, and that's how I found you. And as you went through all the symptoms on your videos, I had like 90% of them.
Okay.
And shortness of breath was just
why don't you just describe some of the symptoms, including maybe go into detail about the shortness of breath, and then you're a singer and...
So I'm not really a singer, but I sing in church.
Right.
Not on the
stage. But you enjoy singing.
I enjoy singing. I enjoy worshiping, and
right.
that's how I like to worship. But So I had, gosh, I'd have to pull out my list of everything, but shortness of breath, can't hit high notes, vertigo, stomach issues, headaches, swallowing issues, memory loss, fatigue. Literally almost everything that you named on there.
Okay.
I'm like, oh my gosh, this has got to be me. I have high liver enzymes that they haven't been able to figure out for 15 years, right? And most of my blockage is on my right side. And where is my liver? On my right side.
Your right vagus nerve,
Yeah.
Yeah. Okay, so when you had the spinning episode or the vertigo, you actually had some other symptoms, right? Like the vertigo was just one of many things. It wasn't like it all started with that, right?
Right.
Well, you weren't fine when the spinning happened.
No.
When was the last time you felt good?
Since before COVID.
Okay.
I would say pre-2020.
Because getting to know you, I mean, obviously, I've joked with you a lot about alpha female. You remind me a lot of my wife.
Right.
So alpha females are notorious for not actually getting sick.
Right.
Because they typically do the right thing. They eat good. Because, you take care of yourself. So all of this has had to have been pretty hard for you, because most alpha females, they like to be in control and they're problem solvers.
Right.
So this probably, that's probably been hard for you. And then you have a high level job, right?
I have 4 businesses.
That's what I mean.
I run 2 mastermind groups. Yeah. So a lot of people depend on me, and I was definitely suffering from depression because I haven't been able to exercise. Some days I couldn't leave the house. I couldn't drive myself. There was a lot of things that I couldn't do. So for a pretty independent person who has a lot of people to rely on her, this was very hard.
Explain what a mastermind group is. I'd never heard that term.
So I'll give you 2 examples. I belong to a mastermind group so we own a couple of automotive shops, right? And 90 of the best shops in the country. We all meet and we help each other with different areas. We visit each other's shops, kind of pick it apart, decide what's good, what's bad, what needs to be changed. The mastermind groups I run are for small businesses, and it's one of different professions, so there's only one person per professional classification. And every month is a different topic where we're helping them learn and grow, and then we want them to develop what we call transformational relationships so that they refer each other.
Oh, that's good. That's awesome. Probably most businesses, we should have something like that,
Well, you don't know what you don't know, right?
Yeah.
And then when you are available to be around your peers, it's amazing what can happen because you learn from each other, you grow. If you're willing to be vulnerable, it's pretty amazing what happens in those meetings.
Now, you said, would you say that prior to coming here, you did probably have a little bit of cognitive decline, like you actually had?
Huge.
Okay, so it's almost like very high level mental capacity then with whatever happened from COVID on, and so that would have been three years or so, then something was affecting your brain in a very, very bad way.
Yeah, so word recall, memory loss, were both huge. So to run those meetings, somebody I've known for 15 years would walk in the room and I couldn't remember their name. And I'm also the president of my Rotary Club.
Okay, wow.
Right? So I love these people. I know them, and I couldn't recall their names.
Okay, now part of why, and I appreciate you being on because you were ready to get treated today, so we just trying to do a quick video. But always when I get into these things, it's just fascinating, just the history. But I did want you to talk a little bit about singing, and I wanted you to talk about shortness of breath, because these are more subtle, a little bit more subtle vagus nerve issues that you might not have even thought of when you came here. But talk about, you were having trouble catching breath, or what was it?
Yeah, so almost all the time, even just sitting down, catching breath, walking upstairs, couldn't catch my breath, sitting in church, trying to catch my breath, standing up to sing, I couldn't do it, so I had to sit down and just breathe. So that...
You really couldn't even sing?
I couldn't, not much, and I really couldn't hit the higher notes that I have been hitting in the past.
So I've been treating you, how long has it been, 10 months, or how many months?
Yeah, so some months we take longer
Okay.
than others. So
So a year.
it'll be a year, I think. It's probably been 10 months.
Okay, so
Yeah.
so 8 treatments. So how are you doing? I mean, I know your treatment regime isn't gone. You know, we're
Right.
not done yet. And then there's the issue that you and I got to talk about your styloid on your right. So,
Right.
but where do you how are you doing?
Well, I noticed a 70% improvement, I'd say, after 5 treatments. And then I got a massage, and they injured me to where my C2 moved to the right, and it put me back about 30%.
Okay,
So that's why we're still continuing
I got
a
you.
little bit more besides the styloid, yeah.
Okay. Well, why don't you just talk about the shortness of breath, the memory, the voice?
Yeah, so all of that, I have no more shortness of breath, which
Okay,
is
so
great.
that totally got resolved.
Memory is still, I'd say it's about 80% better.
That's good. You got to be happy about that,
Yeah.
right?
Oh yeah, I can function.
Yeah.
I can drive myself most of the time now, so no more driving Miss Dizzy, which is nice.
Oh, that was funny. Yeah, you said that driving Miss Dizzy.
Yeah, yeah. And
You can drive yourself, so it got so bad that somebody had to drive
I
you.
had to have my son drive me, my
Yeah.
husband drive me, my employees would have to pick me up
Okay.
just to get to places. Yeah. So it's nice not to have to rely on other people.
So when I say, you know, because on a lot of these videos, I say a lot of health problems that are structural. It's from carotid sheath compression, because in this carotid sheath is the vagus nerve, the jugular vein. I mean, you would absolutely agree with that. You know,
Oh my gosh.
like-
I think when we first did mine, it's supposed to be at like 81 or something is what you said for a female, and mine was at 6.
yeah, some of your jugular vein readings,
We're really, really
instead
bad.
of being 9 by 9 millimeters, or yours were almost 100% closed.
It was terrible.
Yeah.
Yeah.
So you're pretty happy you came here, huh?
I'm pretty happy I came here, even though you tease me.
Yeah. And if this relates to you, if you just feel like, you know, I can't catch my breath, I have air hunger, I have fatigue and I don't know the cause, and I've tried to do healthy diet, I've changed my lifestyle, I've changed my computer height, then we'd love to see you and get you back to health.